Thanks, everybody. We were not too sure about being here today, and we didn't know what to say, and we've kind of put something together. It's going to be quite different from all the other presentations. As you can see, we're all three female. We're all three baby boomers. We all three have been cured of hepatitis C. We're all immigrants, and we're all volunteers at HepCBC. So we're really happy to be here. The first thing we're going to do is Nancy, who is from Thai, actually from Indian extraction, but she was born and raised in Thailand. She's going to talk about her experiences.
Hi. I think we've had a lot of scientific and data talk, so I've been asked to just talk from a patient's perspective. In the ethnic communities where we have extended family, I believe that there's a lot of built-in support. I couldn't imagine anyone going through the treatment alone. We're lucky now that we are seeing treatments that's coming out with less side effects and better success rates. I'm hopeful that together we can increase awareness about Hep C, decrease the stigma that's associated with it, and that one day Hep C will become a disease of the past. Thank you.
And Phong, you want to come up? This is Phong Pham. She's an immigrant to Canada from Vietnam. And she's going to talk to you today about her, about her diagnosis, her treatment, her family, her work as a peer navigator, and a little bit about how people in Vietnam can get hepatitis C in some ways that we haven't talked about so far.
I came from Vietnam as one of the boat people in '79, and learning English and get my training as a nurse and working in the acute care area, chemotherapy. When I find out I have a Hep C, we don't know how I got it. Possibly from work or from back in Vietnam, contaminated by needle or vaccination, we don't know. And so my kids are already on their early 20s, so I would try to protect my kids, not telling them. And of course the stress level is very high, so I couldn't cope with the normal conversation or anything. And so two of my daughters said, they talk to each other, say, I think mom getting crazy. Something is, some kind of mental disorder somewhere that she just not behaving normal. So from that, after that, I always ask, when I help people to, during the treatment, always said, first thing first, you tell your family. Lay it out, that's your main support system there. And also, I wish before I have my treatment that my doctor connected me with the HepCBC so I can learn more before I get into my treatment to know more about what I'm facing. So for me, I said, oh, no problem. I keep on working, take a treatment and go to work, do shift work. I last for 1 day. Well, first treatment, I work for 1 day. Second day, at 9 o'clock, I couldn't hold up my cup of coffee. I was so weak. I couldn't use a chopstick to eat. I have to eat with a spoon. Soup spoon is too heavy. Have to be teaspoon. I have no strength. So I was bawling my eye out, crying my head off because I didn't know any of this. So its support system is very, very good to get someone with the experience guide you through it. And still, like, my Vietnamese population in Canada, we find out we have a high percentage on getting the disease, but we don't know how it from it because back home you do. When I was in school, we have one needle vaccinate for the whole school. We do acupuncture. We don't have sterile needle. We do phlebotomy, blood letting with just one razor blade for everybody. So it's just like very easy to get transmitted throughout the country. So I was able, after my experience, I was able to help whoever Vietnamese got through the treatment. I found that male is tolerate way better than female. That's the way I see it. And
what have you done to help members of your community who have hepatitis C?
Oh, yeah, well, because of aware of how seriously the disease is, so I told all my friends, people I know in my community, go and get tested. Go and get screening to make sure, like, you know, we know what. So from that on, we discovered a couple of cases have Hep C and we didn't know about it. Yeah, it's, and then just help them get through the treatment and help prepare them. What are you heading for? What do you expect? That help. I think it helped a big deal. And I think that's it. Thank you.
We are a very grassroots organization. We get no government funding. We've been around for many years just working off of our kitchen tables, but recently we have gotten a couple of offices. We have one in, there we go. We have one in Victoria, and we just opened one in Vancouver last week. We're still getting the telephones together. So we're just starting to do outreach to the immigrant population right now, and we're going to share with you some of the lessons we've learned, some of our future plans, and maybe even a few of our successes. When you're reaching out to immigrants, everyone prefers meeting new people and hearing new ideas while in their comfort zone. And one great time for reaching out to immigrants is while families are relaxing together and there's more than one generation present. Meeting in places people have learned to trust, with people that they can trust, is really important. And making materials available not only in English but other languages and at a variety of literacy levels, because some people really need a very simple language and other people really appreciate a lot more sophisticated level. Be vigilant not to feed into existing fears and stigma. And this is hard when you're trying to tell people the truth, what really is happening, but you don't want to scare them. So it's hard sometimes to reach a balance. And very important, respect confidentiality. Keep that in mind all the time. Here's a sample of a holder that has some translated pamphlets. You'll probably recognize some of these. And notice we also have hepatitis B there as well as C. These are from Public Health Agency of Canada, from Katie. And the one on the lower left, you'll see it says living healthy, and then there's about 10 other languages. These are all African languages, and we get these from Katie. And all the ones on the right and the Hep C newly diagnosed are also from Katie. And I'm sure Hywell is going to tell you a lot more about these later, but they're extremely useful for us. Here we are at an immigrant food and health fair. This is held every year in Victoria. you can reach people through the ethnic churches, mosques, and temples. This is the Ukrainian Catholic Church in Victoria. You can get info tables or booths at community events. Immigrants usually love to attend these. Healthy living, sporting events. This picture here is of the Victoria Marathon. They often have tables that nonprofit groups can rent, and you can have your pamphlets there. And it's always great if you have immigrants who have different language skills manning those tables. You can volunteer to be a guest speaker at an ESL class. You should find out in advance the countries of origin and languages and cultural background of the students so that you'll have the statistics in hand when you go there. And of course, it's good to discuss the lessons and activities with the teacher. You can use art therapy. This is a sample. It's called body mapping, and Katie has an excellent program. This is wonderful because it transcends language, and it's really useful for finding out more about the people that you're working with. They can express themselves through art, and like it'll even show like which part of your body hurts or that you're concerned about, that sort of thing. And you can advertise these through clinics and immigrant centers. We do this newspaper advertising once a year, just to the general public, but it's also a really good opportunity to put something in it that aims at immigrants as well. And this is the same ad we put in for a couple years, and it does include one immigrant family on the left. And seeing several groups targeted helps diminish the stigma. It's not just us, it's some other people as well. And we made sure that we got the text approved by the ethnic community representatives. And it was interesting, some of the things that they asked us to change. And including a translation of the word hepatitis in several languages, all versions in this one color, that gets people's attention. Even if they don't know those languages, they know, oh, this is aimed at immigrants. This must have something to do with immigrants. This is, I think, the outreach tool that somebody was referring to. It's put out by the World Hepatitis Alliance website. It's possibly in 42 different languages, and it does have English and the translation with it. It gives a space where you can put your own organization's data in it. This took me like 5 minutes to develop. It's wonderful. This one here is in Arabic, but you can change it into some other language immediately. This is the first page is quite simple information, maps, and just simple stuff. But the second page, or the back page, is quite detailed. And yeah, sorry. Here is the website if you want more information. I urge you to write that down. It's an excellent resource. And you can make as few or as many copies as you need. Maybe you can have 5 in Urdu and 50 in Italian, whatever you want. And you can just print it out on your own printer. But if it's actually made as to be a 4-fold pamphlet with A4 size paper. So if you want to get really fancy, you can do it that way through a printer. And it involves both hepatitis B and C and contrasts these with hepatitis A. If anybody else needs this to write down the... Oh, okay, great. World Hepatitis Day, July 28th. It's a great opportunity to reach out to the immigrant communities. This is in Vancouver, planning for World Hepatitis Day. You just make sure you start it as soon as possible. It really helps if you start it on July 29th. And translation takes a lot of time, so make sure that you've got given yourself plenty of time for that. This is the World Hepatitis Day Vancouver Planning Committee. There's even more of us next year. It's very exciting. Advertising, this is, I mentioned it earlier, the World Hepatitis Day ad we put in the paper. We also put out press releases both in English and in other languages to the ethnic press and to ethnic radio. So the text, the actual text that was in the ad is newcomers to Canada often got hepatitis B or C through common medical practices in their home country or even from their mother during birth. Immigrants of any age should consider testing for hepatitis B and C and getting a hepatitis B vaccination. And that basically came from a couple of different immigrant communities in Vancouver, that text. Use stock photos. And some ethnic groups are really underrepresented in stock photos. So if you know anybody from the Middle East, an attractive family that's willing to get their pictures taken, tell them to contact stock photos because there are none. Okay. The World Hepatitis Day in Vancouver includes booths from very diverse populations, such as youth, Aboriginal, marginalized people, men who have sex with men, Asian immigrants, baby boomers, women. And our booth, we take a shotgun approach, and we have posters of everybody. Baby boomers and youth, some people mentioned this earlier today. Don't forget that many immigrants with hepatitis are also baby boomers. And immigrant youth should also be targeted because they may have gotten it through their mother, and also because they're the often great translators for their elders. You don't need to reinvent the wheel doing outreach to immigrants. There's all kinds of resources. This picture here is from the United States, from the Center for Disease Control. Just make sure that you acknowledge the source. Consider including hepatitis B in your outreach. It's not that difficult to include. There's lots of overlap, but if you combine the two, it's really important. Do not totally lump the two diseases together, because if you do, you can give really wrong information. Instead, make sure that you contrast the diseases in terms of vaccine, cure, transmission methods. And this is Jason Chan, a volunteer with Success, openly shared his experiences and struggles as a hepatitis B positive person. And really important, this slide here, this refers to people like Fong, who's willing to be a peer navigator. And in her case, she's been a volunteer, and I think most peer navigators in the immigrant communities are volunteers. But no one can understand the needs of a person just diagnosed or undergoing treatment like someone who's already been there. And no one can understand the cultural aspects affecting that patient's experience like someone from that very same culture. And immigrants need peer navigators who can advocate for them in their language. And you should consider setting up a program in which immigrant peer navigators can be well trained and, if possible, fairly compensated. This is at an immigrant and refugee food and health fair, which they also do every year in Victoria. It only costs us $25, and it's a wonderful bridge building opportunity. It's a great place to meet allies, and you see our poster right in front there. Take nothing for granted. Our booth was colorful, welcoming, and hepatitis C, hepatitis C, hepatitis C everywhere. But some people were made nervous by the word hepatitis and backed away. So, like I say, it's hard to strike a balance. You have to be really cognizant of that. Include both genders when you're doing these booths. Use lots of images. The ABCs are the key to proper care. We discovered many immigrants are unaware of differences between hepatitis A, B, and C. Finding out that hepatitis B and C are not transmitted through the fecal-oral route means family members can be a lot more relaxed. They don't have to fear that their grandparent is going to affect their child. But they are often surprised when they hear us say that they don't have to separate the silverware and dishes from the rest of the family. So even these really simple things, once people get into their head that they can be less cautious, it really helps. Don't be shy. Push the envelope. Put your information, your message right out there. It's an important message that will save people's lives. Put your banner out where everyone can really see it. Use graphic imagery that gets people's attention. However, they can also scare and repel people, so use them sparingly. And they can get people's attention, and then they get their kids maybe to translate for them. Be creative, think young. It takes creativity to attract people to a booth that says hepatitis. Smiles, ribbons, activities for kids, all these help. Do your research. Research your typical age cohorts, countries of origin, and languages of immigrants in your community to help you target your outreach and publication efforts. This here is in Khmer, that same resource. And the second page of this is really interesting. The fear of people with hepatitis C or hepatitis B is a natural response, a human response, if you are unsure how it is contracted. So this really lets people know how it's contracted. And for this, it emphasizes the medical and vertical mother-to-child transmission routes. Not only because they are true for the immigrant population, but they're also less stigmatized. We have some questions for the audience, but I think we're running out of room. If you have any questions about translation from the point of view of a translation agent, I'm a retired translation agent, so you get a hold of me by email. You can get a hold of any of us through our website, and we really look forward to hearing more from you. Thank you.
Excuse me. The final point I have a little story I want to share with you guys when I was in the treatment into my 10 weeks. One day my husband and I walked downtown in Chinatown, and then suddenly I found myself sitting on the sidewalk. My back of my head was throbbing pain, and I heard people walking by asking like whether should I call ambulance. And then my husband say, "She's okay, she's on drugs, so she's okay." When I went home, I asked my husband, "Do you have any idea what you tell people?" I can always laugh with that.
Thank you very much. Yes, we should be very careful with the messages that we put out. I would like to mention here that we at the Canadian Society for International Health have been very pleased with the collaboration we have with HCBC Columbia, and we have collaborated for World Hepatitis Day for a number of years, and we are looking forward to strengthen this collaboration. And we started already to prepare for World Hepatitis Day 2015, and we invite everybody to join this initiative. So you can email me, and I will give you all the information that is necessary.